Very good afternoon, everyone. So I'll be talking on evaluating contrast sensitivity after collagen cross-linking, key findings from the Spaeth-Richmond contrast sensitivity test. So as we all know, keratoconus is a non-inflammatory ectatic disease of the cornea, which causes progressive change in the corneal structure. So keratoconus not just affects the visual acuity, but it also hampers the quality and the higher visual function, of which contrast sensitivity is a very important subset. Now this decline in contrast sensitivity can majorly be attributed to the higher order abrasions that are seen with the keratoconus, where the eye is unable to focus the light properly, more so in the low contrast situation. Now, collagen cross-linking, as we all know, is the established technique that is done, or the treatment protocol that is done to halt the progression of keratoconus. It not just helps in stabilizing the disease, but also shows improvement in the visual acuity and helps in reducing the impact of optical imperfections like higher order abrasions and contrast sensitivity. So it was a good idea to see how contrast sensitivity is getting affected post-collagen cross-linking. Few of the studies that have been done in the past have showed varied results, where few have shown improvement in contrast sensitivity, while few have shown a decrease in contrast sensitivity post-CXL procedure. Another important subset that was seen was that most of these studies have evaluated the contrast sensitivity using Pelly-Robson test, which is a chart-based test, and it measures only the central contrast sensitivity. And being chart-based, it is subject to various limiting factors like literacy rate of the patient and also the fading effect onto the charts. So in order to overcome this limitation, we thought of going ahead and doing contrast sensitivity using the Sparks test, which is Spaeth-Richmond contrast sensitivity test, which is an internet-based test, and it does not just evaluate the central contrast sensitivity, but also evaluates the peripheral contrast sensitivity. So the primary objective of the study was to analyze the change in contrast sensitivity using Sparks in patient undergoing collagen cross-linking. Along with that, also to see changes in keratometry, aberrations, retinal nerve fiber layer thickness, VFI, and the tear film parameters. It was a prospective observational case series done at GMCH Chandigarh. So all the patients of mild to moderate keratoconus who underwent collagen cross-linking were included in the study. The parameters were evaluated preoperatively and then at 3 months post the procedure. The parameters that were evaluated included visual acuity, keratometry readings, retinal nerve fiber layer thickness, VFI scores, and contrast sensitivity was assessed using Sparks, which is basically an internet-based test which can be evaluated on this particular, which can be accessed on this particular website that you see. So the screen is basically divided into 5 quadrants: the central, upper right, upper left, and lower left. And each zone is given a score of 20, so that it contributes to a total score of 100. So the score that you get is out of 100. So all the patients who were included underwent collagen cross-linking using standard residence protocol. So this is the representative image with pre and post CXL pentacam images with their corresponding Sparks image, which shows a change in the score of 1 in the post-operative period. So 24 eyes of 22 patients were included with mean age of 20 years. 60% of them were males. 22 of these eyes had moderate keratoconus and only 2 had mild. None had positive family history, and 6 patients had history of recurrent VKC. Visual acuity remained stable in the post-operative period. Keratometry reading showed an effective decline of 0.5 diopter. Now coming on to the important part, that is the Sparks score. The total Sparks score remains stable over 3 months post-operative period. However, if we look at the subsections or the quadrant-wise, the upper right, central, and lower right showed an effective increase in the contrast sensitivity. However, the results were clinically, statistically insignificant, but it does tell that probably there is a trend towards increase in contrast sensitivity. Higher order abrasion showed an effective decline of 15%. Rest of the parameters were stable. Now looking at the literature, what we understand is that there is drop in contrast sensitivity just in the immediate post-operative period of around 1 to 2 months, followed by increase in contrast sensitivity that is seen over a period of 1 to 2 years. So the major limitation of a study was a shorter follow-up time of just 3 months. A longer follow-up would have given better results, which would have given more substantial results. Apart from that, small sample size and inclusion of mostly moderate keratoconus were another limitations that were seen. So I would like to conclude by saying that it is important to continue to follow up these patients over a long period of time. Also, a larger sample size would have given us and helped substantiate or give more potential results. Thank you.
Thank you. Thank you for finishing in time, madam. What was the age group of all these patients?
Sir, the average age was around 20 years. All the patients above 18 years were taken. It ranged from 19 years to 25 years.
Okay, thank you.